Laura. How are you?
Good, how are you?
You guys ready to get out of here?
Yes.
Okay. Is Dad going down to get the car?
Yes, he is.
Okay. Is it alright if I go over these discharge instructions with you while he's gone?
Yeah.
Okay. Alright. So, I have some instructions for you and baby for whenever
Okay.
you get home, and I highlighted some stuff. It's pretty long, so
Okay.
I highlighted some stuff just so you can see it easily. For you, you should have a really good diet to help your body heal and get back to normal. You should eat foods that are high in fiber. These are things like bran, broccoli, cauliflower, fruits, stuff like that. This will all help keep your bowel movements regular. And then foods that are high in calcium, things like dark green leafy vegetables, milk, and yogurt. And then you should drink plenty of water and non-sugar supplemented juices.
Okay.
So just like regular, like plain apple juice, no sugar added and stuff like that. And then that should be good for your hydration. And then you should avoid things like sodas, soft drinks, coffee, tea, anything like that, alcohol, stuff like that. And then for your activity, you should every day gradually increase. You don't have to start off going crazy. You can build up to your normal routine. And then you should get plenty of rest. Don't do too much lifting, pushing, pulling for the first 2 to 6 weeks.
Okay.
And then if your doctor tells you otherwise, definitely follow that. But don't drive until you're released by your physician to drive also.
Okay.
And then, are you breastfeeding?
Yes.
Okay. So I'll go over some like just overall breast care and then breastfeeding tips after. Your breast nipples may have changed and were grown in size.
Oh, yeah.
Due to your pregnancy. They have.
Yes.
Yeah, that's normal. And then it's terrible. You'll learn to love it. Wearing a well-fitted and supportive bra during the day and at night make you more a little bit comfortable because it'll help your body just while it adjusts to the changes. And then if you need to wear breast pads, that can also help. That'll help for the leaking. You can put like little pads in your bra and they'll soak up any leakage. And speaking of leakage, that should occur for a few weeks to a few months.
Oh, Jesus.
Especially if you're breastfeeding. Yep. And then you can also apply ice packs in between feedings to help with the discomfort of the breastfeeding. And then if you decide to stop breastfeeding, there's some things in here to help you with that, but you can go over that if you decide.
Okay.
And then if you also, obviously at the end I'll tell you if you have any questions, you can give us a call or, you know. And then breastfeeding tips for you and baby. Your baby's mouth should form a tight seal around your areola or around the nipple, but the lips of the baby should be pressing against your areola, so not the actual nipple itself, but around it.
Okay.
And then if the baby is suckling wrong, you can slide a finger between your baby's lip, and then that'll help break the suction, and then reposition and try again.
Okay.
And then for nursing, as far as that goes, you can do it as long as you want, as long as your baby wants. Each time it should be usually, not it should be, but it usually is around 10 to 30 minutes. Okay. And then at first you're going to probably want to nurse so many times within the first 24 hours, but it won't be long each time. They'll be getting used to it. And then it's important for the health of your breast to have your infant feed from both breasts every single feeding. So feed until it's good over here, and then switch to the other side, and then maybe change it up the next time.
Okay.
Good signs of nursing would be hearing your baby swallow without a clicking sound, seeing movement above the baby's ears. This shows that it's like a little wiggle, and it just shows that they're sucking good.
Okay.
And then if you don't see dimples on your baby's cheek, that's also a good sign. And then the baby should be calm, relaxed during the feedings, and then you should feel gentle tugging at your nipple. But after the first few minutes of each breastfeeding session, you shouldn't feel pain after the first few minutes. Okay. So at first it might be uncomfortable and a little bit painful, but after a few minutes it should resolve. And then if you do feel pain, it may mean that the baby is not positioned right on the nipple.
Okay.
Or that the tongue doesn't extend past the lower jaw. For this, you would just remove the baby and try again. For hygiene, you should wash your hands as much as you can because you're caring for yourself, and then that's to prevent infection. For also, whenever you go to the bathroom, make sure that you wipe front to back.
Oh, yep.
After going to the toilet, and make sure you clean your bottom with warm tap water. using the peri bottle. After you pee or have a bowel movement, it's really important for you to use the peri bottle and use it gently. The peri bottle does not go inside of you. It just is used to spray on the outside.
Like a bidet.
Like a bidet, kind of.
Yeah.
But it's gentle. Bidets can be hard. This is gentle.
Okay.
It's important that you change your pad every single time you go to the bathroom. This just keeps bacteria off of your area. And then for bleeding, your bleeding will decrease in amount from bright red to pink to brown to yellow, cream color. All this is normal. The main thing is this should never smell. And it should never, like, say you start out, it's bright red and then it gets pink and then it gets brown and like a yellow clear color. It should never go back to bright red. If it does, that's a problem. You should definitely call your provider about that.
Okay.
And then as far as your period goes, your menstrual cycle, you can start that back as early as 6 weeks, meaning you can get pregnant as early as 6 weeks, and up to 2 months after the birth of your baby. And then if you're breastfeeding, this will be prolonged. For bowel movements, you need to avoid constipation as much as possible. You can take a mild laxative or stool softener until your bowel movements have returned to your normal pattern, if you do have a normal pattern.
Yeah, I'd say so.
And then an increase in your fiber and fluid of your daily diet. And then birth control. I'm not sure if this is something that you would want or not, but
Yes.
if you do, then you would definitely discuss that with your healthcare provider. Usually they like to talk about it at your 6-week appointment,
Okay.
or before, to get an idea. Maybe start it at your 6-week appointment, whatever, or 6-week mark.
Okay.
And then you might want to choose a method of birth control before resuming sexual intercourse.
Okay.
And then for sexual activity, nothing should go into the vagina for the first 6 weeks after discharge, and sexual intercourse should be avoided until bleeding has stopped and whenever you feel physically and emotionally ready. We know this is usually hard for people, so.
I don't think it's gonna be hard for me. It might be hard for my husband.
Oh boy. So, warning signs that you should report to your healthcare provider immediately would be any kind of pain, redness, pain other than the normal to be expected pain, redness, warmth, swelling, drainage, or foul smelling discharge from the incision or the incisions, or if the incision begins to open back up. This would be like your perineal laceration if you had a vaginal birth and you tore, or if you had a C-section incision. We didn't discuss this before, but and then any discharge from the vagina that has a bad odor. Bad odor is bad. That means there's something wrong, probably an infection or something. So definitely need to call about that. And then if you have a severe headache or blurry vision or any kind of visual changes, definitely call. Temperature over 100.4, or if you feel cold, feverish, have the chills, just aren't comfortable, definitely call. And then if you have any thoughts of harming yourself or your baby or others, anything like that, definitely give us a call. Don't be ashamed, don't be embarrassed. Stuff like this happens all the time. Pain or burning sensation, redness, warmth, or swelling in the legs. Breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streak and flu-like symptoms. You definitely want to avoid any kind of infection and picking up on the signs at the beginning. If you do have some kind of infection, would definitely help get it under control before it gets too bad. So definitely call if you have any of that. And then sharp pains in your abdomen, breast, or chest. Those are not normal. And then any trouble breathing, dizziness, or faintness. Any crying spells or mood swings that you feel are out of your control. You feel like you're just crying all the time and you can't control it, you can't stop it, you don't feel like yourself, definitely call. Unable to empty your bladder or urinate, or urination that's painful. Not painful when the urine hits your incision, but painful upon urination. So as soon as you start peeing, if you feel pain right then, definitely call. Or difficulty urinating or really frequent urinating, definitely call. And then of course difficulty having a bowel movement. And then there is a number in here to report any domestic abuse or violence if you need that. And then now on to your infant. So safety for your infant. When it comes to sleeping, your baby should be placed on a flat surface, whether that's crib, bassinet, or what. And they should be laying on their back to sleep. You should use just sleep clothing, so like just a little one-piece sleeper, and do not use a blanket. You should not let anyone smoke around your baby, and you should use a firm mattress that is covered by just a fitted sheet. Car seats and swings and bouncers, stuff like that, are not recommended for sleep. And then do not use pillows, blankets, pillow-like bumpers, anything like that in your infant's crib. You should keep away any soft, like stuffed animals, anything like that, wedges or little positioners for the baby, or any loose bedding, blankets, fitted top sheets, not fitted sheets, but top sheets, anything like that, keep away. And then the baby should definitely at first sleep in the same room as the parents, but no matter what, not in the bed. And then you should always avoid covering the infant's head or overheating the baby. And then for the bulb syringe, you should keep that near the baby at all times. That would be used to clear the baby's throat or nose if it was necessary, if it head was congested, anything like that. That would definitely be good to use. And then you should clean the bulb syringe really well with warm soapy water after each use, and then allow it to air dry. Everyone should definitely, whoever is handling the baby, should wash their hands prior to handling. And then for the car seat, every infant is required by law to be in a car seat while in the car, or while the car is in motion, I should say. And then they should be placed in a child safety seat according to state laws. When they're children, I guess, not infants. At home, whenever the baby's coming home, I know family might want to surprise you and decorate the house and get everything ready for the baby to come home, which is very sweet, but you should make sure that there's no outdoor announcements. Those are not recommended to announce the birth, because then they call attention to the presence of a newborn infant at home, and it just is it calls for a weird situation. And then you should question any unfamiliar people visiting your home or asking tons about your baby after you get discharged. And then do not use home monitors or commercial devices that are marketed to reduce the risk of SIDS. And then for behavior, crying is a normal response for your infant. It is going to be normal. Your baby is going to cry. And then the most likely causes for crying are hunger, diaper change, or needing to burp. You'll figure out your baby and you'll know what your baby needs. You should burp your baby after each feed. And then for calming techniques, you could feed your infant, change their diaper, rub their back or their stomach, walk with your baby, rock your baby, do skin to skin, maybe try a pacifier if that's something that you would be up for. It is never okay to shake your infant. If you get frustrated or angry, place your infant in a safe space like the crib and take a break and call a friend. For any sleep patterns, your baby's going to sleep a lot. You should be waking your baby at least every 3 to 4 hours to feed at first, and then you should place your baby on their back. You should place the baby on their stomach every day for tummy time. This will help their neck and abdomen get stronger. And then for feeding, you're going to be breastfeeding. So your baby should be breastfed 8 to 10 times a day based on the cues of the infant. And then be sure to hold the baby close to you while feeding, cuddle the baby, do skin to skin. After feeding, make sure you hold them upright, usually over your shoulder, and pat them and rub their back so that they can burp. If you do decide to formula feed, there's some stuff in here about that also. And then for newborns, here's some stuff that is normal, not normal. There is such thing as a newborn rash, and it is just a light rash that it's like little small red circular areas, sometimes with a white dot in the middle. This is normal. And then it doesn't require any treatment. It usually resolves within the first week or so. Try to avoid lotions, powders, perfume soaps, anything like that. And then milia are pearly white bumps. Those are usually on the baby's face. especially on their nose, and those will disappear within the first week also. Jaundice. Jaundice is something that's common in newborns, and your baby may have it's whenever your baby has a yellow color appearance to their skin, and it'll start usually on the baby's face and then go down to their toes from there. But if the baby appears more yellow in the first 24 hours, then you need to call your healthcare provider immediately. For bathing, your infant will need to be sponge bathed until the umbilical cord falls off. You should use a soft washcloth, plain water, gentle, all of that. Save the diaper area for last when washing the baby. And then you can also use a mild infant soap. For cord care, keep the umbilical cord clean and dry. Those are the main things you need to do. Just clean and dry. Clean it with warm water and soap whenever it gets soiled or dirty. If the baby pees on it or poop gets on it, anything. Definitely inspect the cord in the surrounding area with every diaper change and just make sure it looks normal. And then if any drainage or discoloration happens, let your provider know. This should fall off within the first 2 weeks of the baby's life. And then for 1 to 2 diapers a day is normal for the first day or two. So the first day we expect 1, second day we expect 2, third day 4, so on. Eventually you'll expect 6 to 8 wet diapers of pale urine every day. And then their bowel movements will begin to change over the next few days from a yellowish green to a mustard yellow, and they'll get really soft in consistency. And then they should have at least 1 bowel movement every 24 hours. And then you can always try and keep record of your baby's wet and dirty diapers to monitor that their hydration and elimination is good. And then,
excuse me, sorry.
You okay?
Mm-hmm.
Need some water? And then when it comes to the genitalia of the baby, is your baby a boy or girl?
It's a boy.
Is your baby circumcised or not?
Yes.
Your baby is a male and he's circumcised. So for circumcised males, you always want to wipe the baby from front to back. This is not just for males. This is not just for circumcisions. Every baby, every child should wipe front to back. This reduces the risk of infection. And then you should be sure to clean all the baby's creases and folds and everything like that to prevent diaper rash. You should pat, dry, and diaper after cleaning. And then apply Vaseline gauze to the circumcision with every single diaper change for at least 24 hours. And then the head of the penis will appear red at first, and then it will change to have a yellowish sticky film. This is normal, and if you see any bright red bleeding or green drainage, you should definitely contact your provider. The plastic ring method of circumcision doesn't require a dressing. The ring that's used will come off usually around 2 weeks, and if you notice any swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. And then to clean the area, you'll just wipe with a really soft washcloth and do it gently. Use a cotton swab or gauze pad and just plain water. And then when it comes to dressing your baby, just dress your baby as you would yourself. If you're hot, your baby's probably hot. If you're cold, or if you feel like it's hot outside to your baby. If it's cold outside to you, it's cold outside to your baby. Avoid overdressing your baby. Too much clothing and too many blankets can cause your baby to become overheated. And then your baby should receive all of the recommended vaccines. Do you have any questions for me?
Nope, I think I'm good.
Alrighty, I'm gonna send this home with you, and you'll have this to look back on if you need anything.
Okay.
Our numbers are on here to call us, and then you'll be seeing your healthcare provider, and they'll be able to help you and answer any questions you have also.
Okay.
Do you need anything else?
No.
Alrighty, I'll leave this
Thank
to
you.
you. Good luck to y'all. You're welcome.
Yes.
Dude, that was so long.